Chronic lymphocytic leukemia, or CLL, is a rare cancer of the white blood cells, which tends to affect older people. White blood cells are responsible for fighting infections. CLL causes the bone marrow to make too many abnormal white blood cells, or B cells, which block up the system and leave less space for healthy blood cells to develop. Among other symptoms, CLL often leaves patients feeling very tired, bloated, and with a poor immune system, so they are prone to infections. Patients' lymph nodes might be swollen, especially around the neck, and they might also feel short of breath. Although CLL is incurable, it is usually slow to progress. But this is different in different people, so the approaches to treatment vary. Sid is in his 70s and has retired from his job as a plumber, but he's still quite active and especially loves ballroom dancing with his wife Sue. They are pretty good at it. When Sid was diagnosed with CLL, it was not just distressing, it was also confusing, because there wasn't a lot of information about it and how to treat it. Chemotherapy seemed to be the only thing available, and the side effects of that seemed like they might be hard to live with, even after the treatment had stopped. Sid's doctor said they were going to watch and wait to see how the CLL progressed, because at this early stage it did not require treatment straight away. Sid and Sue felt scared, knowing Sid had cancer, but that no treatment would be given immediately. The test showed that Sid was okay for a while, but then his abnormal B-cell count rose, and his symptoms started to get worse. He had terrible night sweats, lost weight, and he kept getting infections. Maybe he would have to start treatment. But Sue had been doing some research, and she got talking to a support group. She heard that there were new targeted medications available, and even stem cell transplant treatments. Sid and Sue went back to their doctor to discuss their research. The doctor agreed that Sid would try one of the new treatments, because in his case, he wanted to keep dancing, and the regular trips to the hospital that come with chemotherapy did not suit them. The new treatment is working well, and Sid continues to take it daily. Sid knows that at some stage in the future, he may have to change treatment. But he and Sue are back to the ballroom dancing, and they have even learned some new moves.